What I'm going to talk about is what I call vitality weight loss, which is using HCG and HRT for long-term results. Of course, HCG being human chorionic gonadotropin and HRT being bioidentical hormone replacement. I just want everybody to understand that it's important to notice that alone HCG and bioidentical hormone replacement will not cause weight loss. However, when you incorporate them with a specific weight management program, then the chances for losing weight and keeping the weight off are extremely high. Throughout time, about 8,000 years ago, being obese was a sign of health and prosperity in men and beauty in women. Before that, the possible exception of, with the possible exception of some races, obesity was almost non-existent. Today, 65% of Americans are overweight or obese. The problem is that the average American diet consists of high glycemic carbohydrates and high fat. The foods that we eat are full of chemicals, steroids, and antibiotics. We all know this stuff. Most people eat less than 3 meals a day. One of the things that I'm a big believer in long-term weight loss is metabolism, which we'll talk about. Most of us don't get enough exercise, and the fact is that most of the weight loss programs out there simply do not work for long-term. Why most diets don't work is because with weight loss and fat loss, there's a loss of lean muscle. The lean muscle loss slows metabolism, and a slow metabolism will result in gaining weight back, and we see these people even gain more weight back than when they started. Roller coaster dieting, people go on and off diets constantly. That will also decrease metabolism. When we lose weight, we decrease fat cell size. When we gain weight, we increase fat cell size and number. So the more and more you diet, the more difficult it is to lose weight. Factors in weight loss and weight gain, again, is the slow metabolism. Again, the more you diet, the harder it is to lose weight. Also, people that are obese, or when we gain weight, it affects our hormone levels. Weight gain can cause hormone level changes. Changes in hormone levels can cause weight gain. So these important hormones that keep us young and give us vitality and help us stay lean, they change, which again makes it more difficult to keep our weight off. Most weight loss programs do not address hormone levels, and obesity, like aging, again results in a decrease in lean muscle and an increase in body fat. Other factors are lifestyle, health status, genetics, stress and emotional issues because of cortisol, and again, letting yourself get hungry can cause careless eating. Diets that cause muscle loss, again, we're talking about metabolism, is starvation and ketosis diets. Very low calorie diets that are less than 800 calories a day, unless you use something that we're going to talk about in a minute called HCG. Long-term appetite suppressants and diets that recommend eating less than 3 meals a day, again, slows metabolism. There's 3 different types of fat in our bodies: structural, normal, and abnormal. Structural fat is the fat that protects our organs. It's the fat at the bottom of our feet. Without it, we can't walk. It helps keep our skin looking good. So it's a fat that's very, very important. Normal fat are the normal reserves of fat in our body that the body needs when we need energy. It's also called normal because it's a fat that we need to have. Structural and reserve fat are normal, and even if the body stocks them to capacity, they can never be called obesity. Now it's the abnormal fat. The abnormal fat is, like it says, entirely abnormal. It's the fat that everybody that starts a weight loss program wants to lose. It's the fat around the bellies, the hip, the thighs, and your arms. It can be used as a reserve of fuel, but it's the last thing that the body goes after if it needs energy. Fat and starvation. When obese patients try to lose weight by starving themselves, they will first lose the normal fat. When the normal fat is exhausted, the body starts burning structural fat. And lastly, abnormal fat reserves are eventually burned. So what happens in a starvation diet over a period of time? The obese or overweight patient will usually feel so weak and hungry that they abandon the diet. They complain that they feel famished and tired, and their face becomes drawn and haggard. But their belly, hips, thighs, and upper arms show little improvement by losing the wrong fat. The fat that they have come to the test stays on, and the fat they want to lose that covers their the fat that covers their bones that they need becomes less. And these people, you know, they look frail. Their skin looks very leathery, and they end up abandoning the diets, and we see that all the time. Human chorionic gonadotropin. What is it? Okay. It's a protein or a hormone produced in pregnancy that stimulates production of progesterone, allowing the uterus to sustain a growing fetus. The HCG hormone protects and nourishes the fetus by delivering calories to the placenta by obtaining nutrition from the mother. During pregnancy, if a mother does not eat enough to nourish the fetus, the HCG will provide adequate nutrition by obtaining calories from the mother's fat reserves and feed the baby. The indication by the FDA in women is it's used to treat infertility by stimulating ovulation and allows for the final maturation of the eggs. It's used to test for pregnancy, and HCG is extracted from the urine in pregnant women, tested in the lab for potency, and sterilization is performed. In men, we've been using HCG for years for the treatment of hypogonadism. It stimulates the testes to produce more testosterone, so it actually will help naturally raise testosterone in a man. The initial research on HCG was done over 50 years ago by a guy named Dr. Simeons. He began treating obese men and non-pregnant women with small dosages of HCG while placing them on a low-calorie diet, about 500 calories for 6 weeks. The results were that the individuals lost an average of about a pound a day. It actually helped the patients maintain their lean muscle. The HCG targeted the abnormal fat and not the normal structural fat. So their skin remained fresh looking, their figures became more normal, and inches were lost in the areas that most people want to lose weight. The other thing is the patients lacked the symptoms that one would expect from a low-calorie diet, where they had no headaches, hunger pains, cravings, weakness, or irritability, which you would normally expect in a low-calorie diet. And also there were none to minimal side effects. And then since then, tens of thousands of people have used HCG with a weight loss program for weight loss. This is a clinical study that was done in 1973. They took 2 groups of females, 20 in a group. Both of the groups had the same diet. One of the groups were given HCG. And the results showed that the group with HCG lost more mean weight. They had a greater mean weight loss per injection. And they also noticed that throughout the diet, the HCG group had little or no hunger, felt good to excellent compared to the placebo group. And this is 1993 in the American Journal of Clinical Nutrition.